very good evening to all of you. Welcome to yet another episode of Dr. KK's Med Talks. I am Dr. Soumya Sachdeva. I am an MD dermatologist, and it is a great honor for me to be here hosting this episode. It is episode 762 of Dr. KK's Med Talks. Dr. KK, late Dr. KK Agarwal, he was a Padma Shri awardee and a gem for Indian medicine. We all miss you, sir. So today, the topic of today's session is how to deal with acne and hair fall. And for this, we have an eminent speaker with us. Please welcome Dr. Saloni Katoj. She is an MD dermatologist at Dr. K.N. Barua Institute of Dermatological Sciences, and she wears many hats. She has many index publications. She's also the convener of IDVL Mentorship Committee. IDVL is Indian Institute of Dermatology, Venereology, and Leprosy. She is the editor of Reflections and IDVL coffee table textbook. She is also the chair of Association of Cutaneous Surgery Youth Millennials section. So welcome, ma'am. Welcome to the show.
A very good evening, Dr. Soumya, and a very good evening to all the viewers who've joined us today. It is indeed an honor and privilege to be here on Dr. KK Agarwal's Med Talks. Sir is a legend, and it is such an honor to be on this platform that he used, to spread public awareness. So I'm glad to be here. Thank you so much.
So, without much ado, let's start with today's session. So, we'll first talk about acne. So, there's a study published in British Medical Journal in 1989, which says that a person in their lifetime is more likely to suffer from acne than from any other disease. It affects 9.4% of the world population, and around 80% of the adolescents suffer from acne. So, Dr. Saloni, please let our audience know what are the types of acne and what are the age group in which acne usually occurs? Can it occur at a age group other than adolescence and teenage?
Right. So acne is basically, an issue of the oil gland of the skin. Skin, of course, is, the largest organ in the body, and these oil glands are present all over the body. So any obstruction in the outlet of this oil gland can lead to something known as acne, right? So let me explain to you what are the different types. So when this oil duct gets blocked, there's accumulation of oil within the skin that can lead to something known as, closed and open comedones. The open comedones are very commonly known as blackheads, so that's basically the oxidation of the oil. That's why they appear black in color. When this oil accumulation gets infected, then you start getting these red eruptions and red bumps on the face. And this, of course, when there's so much accumulation, infection, the oil duct may also rupture, and spread its contents into the surrounding skin structure, which leads to a very, very severe form of acne, which is, nodulocystic acne. So grade one would just be these small, blackheads and whiteheads. Grade two is when, there's some infection, some amount of pustules come in. Grade three, of course, is when nodules come in, when the infection is of greater severity. And grade four is a very severe grade of acne where you can have nodules and boils and cysts all over the face, including, the chest and the back as well. So that would be the grades of acne, the severity. Now, the types of acne, as you very, rightly asked, can it affect any other age group apart from the adolescent age group? The answer is yes. So there is something known as infantile acne, which can occur during the first few months of life. This is under the influence of the maternal hormones, which pass on to the child. So it's basically a benign condition, can be treated, with a topical medicine. Sometimes it may go away on its own. Then, of course, is the adolescent age group, which is because of the physiological hormonal changes that take place. In some children or adolescents, it may be mild. In some, it may be moderate to severe. So that's where we step in and, sort of treat them, especially when it's moderate to severe, because that can lead to scarring. Then, of course, is adult acne. Acne which presents during a later part of life, after adolescence, after say about 25, 28 years of age. And this can be seen in women who suffer from hormonal issues like polycystic ovarian disease. And this can also be external in nature when a lot of occlusive makeup is being used. Now, of course, the mask acne has come in. During the pandemic, a lot of mask was also being worn. So acne can present in the adult range as well. So that is adult acne. And sometimes even in the elderly age group, you can see something known as senile comedones. That is basically because of wear and tear of skin, and again, the sebum and other dead cells may accumulate, and that may lead to these sort of large comedones in the elderly age group as well. So these would be the different age groups that can be affected depending upon the site. Of course, we all know about acne on the face, but they can also be truncal acne, which is predominantly over the back, and can also affect the arms, sometimes the chest as well. So that would be the answer in a nutshell. I hope everybody's understood it well.
Yes, Dr. Saloni, I couldn't agree more with you. And I like to add that if you are above the age of 25 years, if you're an elder person and you are having flare of acne, you are having irregular menstrual cycles, and acne is more over the jawline area. You are having more of hair on your face or at places where it's not meant to be. Probably there is an hormonal cause to the acne, and it is best to see a dermatologist for that. So, moving ahead, there are a lot of people who tell that when they use makeup, they see that the acne aggravates or there's a flare of acne, or some people feel that I shouldn't use makeup if I suffer from bouts of acne. So, how much truth is there in that, and what is your advice regarding that?
Right. I think we live in an age where, a lot of people use cosmetics, men and women both. So there is some truth to it, especially in people who have oily skin, who have skin that is genetically predisposed to acne. If these individuals, wear a lot of oil-based makeup, thick, occlusive makeup very frequently, they don't wash it off before going to bed, that itself can lead to an external occlusion of the opening of the oil duct, which is on the skin surface, right? So that can aggravate the acne. In other individuals who have dry to normal skin, regular usage of makeup should be all right. But as I said, the general rule is that you need to wash off the makeup before you go to sleep so that, your pores can breathe. The skin otherwise will also be healthy if you remove all the makeup, put a moisturizer, and go to sleep. So, for people who have oily skin, I would recommend that it's better that you used water-based, cosmetics over your face. Either gel or a lotion would be better as compared to a cream that could be more occlusive in nature and can aggravate your pre-existing acne.
Yes, that's very aptly mentioned, Dr. Saloni. So, actually, there is a type of acne in our medical books which occurs due to the excess use of makeup, and that is called acne cosmetica. But nevertheless, the golden rule is never to sleep with your makeup on. I think that is the best. Sometimes you have to use makeup, and that's fine as long as you wash it off before going to bed. So the next question is so there are many food items which a lot of people think that can flare acne. People notice that some food items do lead to acne, and is there any dietary items you would suggest that people should not consume if they get acne, or if they get frequent flares of acne? So regarding diet and its correlation with acne, please throw some light on that.
Right. So there have been a lot of studies, the results are, some studies are in favor, some studies are against it. But what they do say is that a diet with high glycemic index, can aggravate acne. It may not happen for everybody, but some individuals, who are otherwise genetically predisposed may find that their acne is flaring when there is an intake of diet, which is, like dairy products, or, items that are very rich in sugar, oily food, fried food, right? So if you do have acne, and if you feel that it's flaring up on intake of any of these products, you can sort of reduce it slightly. I will give you my example itself. I usually don't break out into acne, but when I eat a lot of pickle, oily food, sometimes I do find that I'm breaking out. So that could be specific for me. It may not happen to other people. So if you do find that, there is an aggravation of acne, or if you're breaking out on eating a particular type of food product, then please, reduce it, or consume it in moderate amounts so that, there is no aggravation as such.
Yes, I agree completely with you. And as a general rule, if you are a teenager, young girl, or a young boy, and you suffer from frequent acne, it's always better to avoid fried food, to avoid outside food, avoid dairy products, and eat more of healthy food, fruits and vegetables. That is always a better strategy, not just for your skin, not just for your acne, but for your overall well-being. So,
True. Yes.
yes. So, next question that everybody would, I'm sure, want to know, those who are here, who have joined us. Also, if anybody has any questions, just to say, you are free to ask your questions in the comment box. So, what is your advice to people who suffer from acne, younger individuals, older individuals, how they should take care of their skin? What they should be doing, and what are the things they should be avoiding in general as a dermatologist? Please let our viewers know.
See, this era that we're in, of social media and Instagram, and everybody wants to look flawless, and the standards that have been set, for beauty, if I may say, are quite, they're not realistic. And these children and adolescent individuals, tend to measure themselves against these unrealistic standards. So I think it puts them under a lot of pressure. So my advice to young children and adolescents who are suffering from acne is not to lose their self esteem, because since they're under a lot of pressure, they may feel depressed, they may feel anxious, they may feel self aware, they may not want to go out if they're breaking out into acne. And this also leads to them scratching their pimples off. They may think that, oh, it's not going away, let me just scratch it, so that'll make it go away faster, but that's not actually true. If you tend to scratch your acne, it is going to leave behind permanent marks, permanent scars. Your skin is going to get depressed, which is even more difficult to treat. So what is very important is that if you do feel that way, if you're feeling depressed, if you're feeling anxious, do talk to your parents, right? And always come and see a board certified dermatologist, that is a DVD, MD, or DNB dermatologist. So please go to them, and they will definitely give you advice as to what is to be done. They may give you just applications for your skin, or they may give you oral medicines if the acne is of a more severe degree. And of course, there are other procedural treatments which may also come in at a later date, right? So, this is in general. The second thing I would like to say is, as Dr. Soumya has already mentioned, your lifestyle has to be good, right? Your skin is a mirror to your mind and body. Flawless skin is a misconception. Your skin keeps changing according to what you feel and what you do and how your body is doing, right? So if you're sleeping late, you will have dark circles. You need to sleep well, okay? You need to eat a lot of fruits and vegetables. Exercise has to be there. It's very good, especially in girls who have PCOD, which is also very common nowadays. Right? And meditation, all these are good habits and should be inculcated. Even things like smoking and excessive alcohol consumption. Smoking, especially, is very, very bad for your skin. It creates a lot of negative radicals, and it can also aggravate acne as well. So, smoking, excessive alcohol consumption should also be avoided. And in general, don't take advice from your friends and your parlor wali auntie, or other people around you, because they will tend to tell you what works for them. It may not work for you. Everybody's skin is different. You're an individual. What suits X, Y, and Z may not suit your face. So it's always better to go and see a dermatologist, and I'm sure they will help you out. And there's no need to worry, no need to be anxious, and never ever measure yourself against the unrealistic standards of beauty that have been set forth by our, I would say, our society and the industry as such.
I concur with you truly, Dr. Saloni. So I myself, in my clinic, do see a lot of patients who've been to so many other doctors who call themselves cosmetologists, but actually they do
Right.
not hold a cosmetology degree. And I see patients who have, they have just they were having a very mild acne, so to say, and it has been flared by the use of wrong products, by the use of wrong recommendations from Instagram. In today's world, there is just so much there on the social
Yeah.
media. And right, there is correct information, but there is misinformation as well. So,
Yes.
of course, we are exposed to all this. But as a doctor, I would just suggest, just as Dr. Saloni pointed out, that for your skin concerns, just don't go to anybody who mentions themselves as a cosmetologist or an esthetician. Go to a
Yes.
person who is an MD or a DNB dermatologist who has a degree in being a skin specialist, and a minor concern may just flare up and take months and years to go away, which is just something which could go away in a matter of a month or a days for that matter. So that is one thing that I would like to share with the audience, because through this platform. So moving ahead, so we are halfway through. So let's move on to the next topic, and that is about hair fall. And in today's world, it's very rampant. Almost 8 out of 10 people have hair fall. One of the major causes of hair fall is stress. And today, in the urban lifestyle, everybody has some sort of stress, whether it is work stress, it is family stress, it is relationship stress. So everybody has stress, and that definitely does aggravate hair fall. So, Dr. Saloni, what are the causes of hair fall? One is stress, as I mentioned, and other than that, what are the causes, and why does it occur that frequently?
Right. So, hair fall can basically be, classified into, depending upon the causes, into four to five. Uh, One of the most common causes, as you've already mentioned, is stress, psychological, emotional stress, also stress to the body. Stress to the body could be in the form of an illness, an acute viral infection, of an unexplained fever for a long time, or any other severe illness, surgery, severe exercise, sudden weight loss, right? So these are also other form of stressors to the body. Second, I would say is nutritional. In India, it is very, very common, especially women after pregnancy. Most of them are iron deficient. So, iron deficiency is a very, very common cause for hair fall. Vitamin B12 deficiency, vitamin D3 deficiency, right? So, nutritional, of course, is another reason. Third, I would say is hormonal. In case of men, we see male pattern hair loss, which is due to their inbuilt hormone testosterone. May also have genetic predisposition. And in women, of course, there is thyroid issues, hypothyroidism, and PCOD again because of the hormonal imbalance can lead to sort of recession of the hairline, thinning of hair, etc. And fourth, of course, is chemical treatments to the hair. Straightening, smoothening, or coloring. All these things can actually weaken your hair shaft. So you may find that the hair is, become very brittle and it's sort of breaking off in between. So I would say these are the, four, five causes which can lead to hair fall. And it is very common now, I think, because of our lifestyle. There is so much stress at work and the type of food that we eat, a lot of adulteration in a lot of food products as well. So I think that's the reason why hair fall is so common these days.
Right. I couldn't agree more. And somebody in the comment section has asked about post COVID hair fall, and I
Right.
also had that question for you. So, there is a study which was done on 198 patients who were COVID positive, and 39.9% of males and 60% of females reported hair fall post the COVID episode. So, this has been very common, and we've been seeing that in our clinics as well. So, what is your advice to all those who are suffering from post COVID hair fall and who are stressed about it?
See, post-COVID hair fall would equate to, hair fall that is seen post any acute viral illness. It could even be chickenpox, dengue, and other things. So, this sort of hair fall, which occurs, say, a month or two after the acute illness, is referred to as telogen effluvium. It could be scary because you can lose up to 50 to 70% of the hair volume, so your hair, which was very thick, may suddenly, start looking very thin and limp. And that's why the patients are very, very anxious, stressed, and that may also add on to the hair fall, right? So post-COVID hair fall is just telogen effluvium, secondly, to the viral infection. Now, see, in general, also, even if you don't treat it, it may come down slowly on its own. If you take care of your health, you take care of your diet, nutrients, eat a lot of fruits and vegetables rich in antioxidants, iron rich diet, and again, same thing, meditation, relaxation, and other things. So slowly it may come back, to your normal hair growth. But if you do feel that it's stressing you out and you're really worried about the quantity of hair which has come down drastically, then you must go and see your dermatologist. They will prescribe hair supplements for you, which will contain different vitamins, micronutrients, as well as biotin, and may also give you some hair growth peptides or some hair growth topical medications as well, which will help in slowly stopping the hair fall. And then, of course, over a period of, I would say, 4 to 6 months, you will find that the hair volume is, coming back to normal. So, very importantly, do not get scared. the hair usually comes back to its normal volume. And if you do feel that it's making you very anxious, please go and see your dermatologist.
Right. So you see, post-COVID hair fall should get normal by the end of 4 to 5 months, to say. And stressing about it actually leads to a vicious cycle of more hair fall. So if you are stressed, if you are concerned about it, you should see a skin specialist. That is a better way about it. But as we mentioned, usually this is an acute erosion effluvium and should get corrected in 4 months. So, what are the food items or any relationship of diet or anything in our diet that we should incorporate to get good hair? And for those who suffer from hair fall, what are the things that they should be consuming extra other than the normal diet?
Right. So, see, generally, when patients do come to us with hair fall, we do check their iron levels, that's ferritin, their D3 levels, and their B12 levels as well. So, in general, if patients with hair fall need to take some diet, they need to consume iron-rich diet. So, a lot of green leafy vegetables, dates, pomegranate, things that are rich in iron need to be consumed. Protein rich diet, very important. Egg whites are very, very good, and even fish, omega 3 fatty acids, diet that is rich in omega 3 fatty acids is also good. And in general, fruits and vegetables very rich in antioxidants, vitamin C, vitamin E, right? So I would say these are the three, four things, that need to be taken if somebody is really conscious about their hair. And apart from this, of course, if you do see a dermatologist, they will also give you something, which has micronutrients and other nutrients. Biotin, specifically, I mean, there are a lot of studies which say that it does help, but I would say that the results are, still debated whether it does or does not help. But of course, it does not harm the patient. Good for your skin and hair otherwise. So, your dermatologist may also prescribe these nutrients for you. So, a diet that is basically rich in fruits, vegetables, protein, iron, and also B12. A lot of strict vegetarians can be deficient in B12. So, you have to take diet that, does contain vitamin B12, which is again fish, egg, pulses for vegetarians. If they are B12 deficient, then they have to, be supplemented or take injections for the same.
Completely agree with you, Dr. Saloni. So there is a question in the comment section. Miss Manisha Sharma has asked, Doctor, I have frizzy hair, and what can I do about it?
Right. So see, frizzy hair basically happens, when there's a lot of static electricity between the hair is dry, right? And it tends to become unmanageable, right? So what we usually do recommend for frizzy hair or hair, that becomes dry and unmanageable is you need to use basically a mild shampoo, right? A shampoo which will not really clear your hair off of all the sebum and your own natural oil. That's very important, right? For people who have oily scalp, and oily hair, you can use, stronger shampoos which contain sodium lauryl sulfate. But for those who have frizzy hair, dry hair, chemically treated hair, it's better to go in for milder shampoos which probably don't contain, the lauryl sulfate and contain other cleansing agents that are milder in nature. So your own natural oil will be, kept in place. It will, of course, clean the dirt, but it will, keep your natural oils there. Number two would be to use a conditioner. Okay, so a conditioner is something which will coat your hair, right? It will make it more manageable. It will make it more shiny, more lustrous, and it will make it more soft and supple as well. So a good conditioner is something that I would recommend for you. Third, of course, will be, oil can also act as a conditioner, right? So you can use, if you like, coconut oil, and there are these other jojoba oil and other things. You can oil your hair, but please make sure you wash it off in about 45 minutes to 1 hour before, have I mean, at the time of your head bath. Because if you keep it on, it's just going to attract more dirt, and that may further aggravate scalp conditions like seborrheic dermatitis. So you can go in for oiling, but please make sure. I would recommend coconut oil. That's been time tested and is being used since ages. But please make sure you wash it off after about 45 minutes to 1 hour. So I would recommend these three or four points for managing frizzy hair. But having said that, if you genetically have frizzy hair, which means that your parents also have it, then I think these external things will help you. If you do go in for straightening and other, smoothening treatments, that may further sort of damage your hair. Temporarily it may feel good, but after a period of time, you will find that the hair is again getting more and more dry. So these 3 or 4 things should help you out.
Right. So we are in the last 5 minutes, so we'll take one more question. So,
Right.
what about hair treatments like bleaching of hair, coloring the hair, ironing the hair? Does that damage the hair and does that lead to hair fall?
Yes, to a certain extent, because it does damage. Straightening, smoothing is based on, sort of breaking those keratin bonds, which make your hair, curly. So the hair shaft does become weak, and you may find that, it's become more brittle, it's become more dry, and it's sort of, falling off while you try to comb your hair. So I think straightening, smoothing, coloring for those patients who are already experiencing hair fall, I think please avoid it for now. I would recommend temporary methods, of straightening. If you have a function, you really have to do it. Please use temporary methods of, smoothing or straightening your hair, and keep these other permanent treatments at bay till at least your hair fall has stopped. That's very, very important.
And blow drying your hair is always better than ironing your hair if you need to go somewhere out. So, one last question that's there: how to stay motivated to therapy? It has been asked by Dr. Vignesh Narayan.
Okay.
I guess he's talking about therapy for hair fall. So,
Okay.
how do the patients stay motivated to therapy? Because it takes time for the results to show.
Yes, I would say in case of telogen effluvium, the patients themselves realize that after about 2 to 3 months, the hair fall is stopped, and slowly over a period of time, the hair is coming back. In case of male pattern hair loss, that's where the motivation is actually needed, especially if you're giving them topical applications. They need to use it, for a very long time. So I think counseling is a very, very important part of your consultation. You need to counsel the patient. You need to tell them that it is going to take time, and they have to continue the applications till the time, they want hair growth on their head. I'm talking about male pattern hair loss. Telogen effluvium, of course, in about 4 to 6 months' time, the patient finds that the hair will sort of come back. But in male pattern hair loss, yes, I think compliance can be an issue sometimes. Patients do get demotivated. So you need to keep counseling them as and when they come back. And I think showing them, taking photographs. If at baseline, at 3 months, at 6 months, at 9 months, on an average, I tell patients it will take about 6 to 9 months to see any hair growth in a patient of male pattern hair loss, right? So you take photographs and you show them that this is what you had, and this is what you have now. There is some amount of hair growth coming. So once they see that, when they see even some amount of a positive result, they tend to stick to the therapy. Even if you're doing procedures like PRP and other things, make sure you take photographs, you show them that there is an improvement. You can do trichoscopy as well. That will give you an earlier sign that they are responding to treatment. So counseling, showing them the results, that's very important. And of course, I think they also need a lot of support from their, friends and family as well. So you need to counsel everyone together. That's very, very important.
Right. So we are at the end of today's session. It was a wonderful session with you, Dr. Saloni. And at the end, I want to mention one thing to our viewers because we have a lot of audience with us who are here to listen about acne and hair fall. Remember, dermatologists are the true skincare experts. Don't go to anybody who claims themselves to be esthetician, to be a cosmetologist, or to be a skin expert without a degree because that is like playing with your skin. I'm sure Dr. Saloni agrees with that.
Yes, absolutely. I think Dr. Soumya has made this statement in public interest. It's very important that you take care of your skin and entrust it to someone who's actually, certified for it, who's actually been trained for it. There are a lot of cosmetology 2 day, 4 day, 1 month, 3 month courses, which a lot of people do. But it's very important for you to understand that as a medical professional, we undergo years and years of rigorous training so that we can understand what your skin is, what the diseases are, what complications are, how can we treat them, and how it would benefit you, right? So that's why we also call you, for a follow up. And we will not sort of tell you to do procedures or do this or do that straight away as you come to us, right? So it's very important for you to understand that your skin needs to be entrusted. It's, after all, the largest organ in your body. It needs time, it needs effort, and it definitely needs a good board certified dermatologist. So this is, issued in interest for the public, and it's very, very important because quackery now is very, very rampant. So
Thank you, Dr. Saloni, for the insight. I'm sure everybody has gained tremendously from the session. So, I wish all of you good night. Have a great day, and bye bye.
thank you, Dr. Soumya, and thank you to all the viewers for joining us today. I hope we've answered your questions, and I hope that we can meet again, to solve and answer all your queries. Thank you so much. Good night, and yeah, bye bye.
Bye.
Bye bye.